Everything you've been told about morning burning leg pain is actually keeping you stuck. Most people jump out of bed, start walking around, and hope the pain eases up on its own. The surprising truth is that your lower back often stiffens overnight and your spinal discs naturally absorb water while you sleep. If you already have a disc bulge, that added fluid can cause the disc to become slightly fuller, increasing pressure on an already irritated nerve, making those first few steps in the morning the most painful part of your day. Today, I'll show you 3 simple moves you can do before you even get out of bed. These are the same moves I recommend to my patients to help loosen the lower back, reduce pressure on irritated nerves, and calm that burning pain before it starts. They are easy, safe, and take just a few minutes to perform. Keep watching. If you're dealing with burning leg pain first thing in the morning, you probably know exactly what this feels like. You wake up, swing your legs over the side of the bed, stand up, and those first few steps feel stiff, painful, or even send a burning sensation down your leg. One of the biggest frustrations I hear from patients is that they feel a little better as the day goes on, only to wake up the next morning and start all over again. What many people do not realize that after a full night of lying down, the lower back and surrounding tissues can become stiff, while a disc bulge may place even more pressure on an already irritated nerve. That combination can make the morning the most uncomfortable part of the day. The good news is that a few simple movements before you get out of bed can help loosen the lower back, reduce nerve irritation, and make those first steps feel much more comfortable. Let's start with the first move. The first move is a seated pelvic tilt. This is a simple way to loosen a stiff lower back first thing in the morning and gently reduce pressure on an irritated disc and nerve. Sit at the edge of your bed with both feet flat on the floor. Slowly roll your pelvis backwards so your lower back rounds slightly. Then reverse the motion and gently tilt your pelvis forward, creating a small arch in your lower back. Move back and forth in a slow, controlled manner. Start with 10 repetitions. If the movement feels good and your symptoms begin to settle, you can gradually work up to 20 or even 30 repetitions. As you perform the movement, pay attention to how your leg feels. Do you notice the burning slightly easing even as you move? Many patients discover a position where the pressure on their nerve feels reduced and the symptoms begin to calm down. That is exactly what we are looking for. Keep the movement gentle and comfortable. The goal is to get the lower back moving, relieve pressure around the irritated nerve, and make those first steps out of bed feel much easier. Before I show you move number 2, if you're new here, I'm Dr. Cordova, a chiropractor in Houston, Texas. For the past 29 years, I've helped patients with back pain, disc problems, and sciatic nerve irritation get back to doing the things they enjoy. If you found move number 1 helpful so far, drop a comment below and let me know. And be sure to subscribe for more videos that help you relieve sciatica, reduce back pain, and keep your spine healthy with simple strategies you can use at home. Now let's move on to move number 2. The second move is a seated sciatic nerve floss. This exercise helps the sciatic nerve move more freely and can reduce irritation along the entire nerve pathway, including the nerve roots in your lower back that may be sensitive from a disc bulge. Sit at the edge of your bed with good posture. Slowly straighten your painful leg out in front of you while you're pulling your toes towards your body. At the same time, gently look up towards the ceiling, then return to the starting position by bending your knee and looking down slightly. Move back and forth in a slow, comfortable rhythm. Start with 10 repetitions. If it feels good and your symptoms continue to improve, you can gradually work up to 30 repetitions. As you perform the movement, pay attention to how your symptoms respond. You may feel the burning sensation ease, move farther up the leg, or become less intense. These are often encouraging signs that the nerve is becoming less irritated. Keep the motion smooth and gentle. The goal is not to stretch aggressively, but to help the nerve glide more comfortably, reduce irritation, and make those first steps out of bed feel easier. The third move is the seated Piriformis stretch. This exercise targets the area deep in the buttock where the sciatic nerve can become irritated as it passes near the piriformis muscle. If that muscle becomes tight, it can add even more pressure to an already sensitive nerve and contribute to the burning pain running down the leg. Sit at the edge of your bed with both feet on the floor, cross the ankle of your painful side over your opposite knee. Then lean forward slowly until you feel a gentle stretch deep in the buttock. Hold that position for 10 seconds, then sit back up and relax. Repeat for a total of 3 repetitions. After stretching the painful side, repeat the same stretch on the opposite side. Even if that side is not bothering you, keeping both hips moving well can help maintain better balance and mobility through the pelvis and lower back. As you hold the stretch, pay attention to how the leg feels. Some people notice the burning sensation begin to settle, while others simply feel less tension through the hip and buttock. Both are positive signs. Keep the stretch gentle and comfortable. The goal is to create a little more space around the sciatic nerve, reduce irritation, and help you start your day with less pain and stiffness. You now have 3 simple moves you can do before getting out of bed to help reduce morning burning leg pain, loosen the stiff lower back, and calm irritation around the sciatic nerve. Use them consistently and pay attention to which movements give you the most relief. If you found these exercises helpful, Let me know in the comments below. I'd love to hear how you're doing and which move worked best for you. If your burning leg pain continues despite trying these exercises, it may be time for a more thorough evaluation. Spinal examination can help identify whether a disc bulge, nerve irritation, or another underlying issue is contributing to your symptoms. We have 3 clinics in the Houston area, and we've helped many patients find lasting relief from sciatica and burning leg pain using chiropractic care, spinal decompression, and other non-surgical treatment approaches designed to address the underlying cause. If you found value in this video, please like, share, and subscribe so you don't miss future videos on back pain, sciatica, and spinal health. If burning leg pain is waking you up at night, watch this next video where I show you the best sleeping positions to reduce pressure on the sciatic nerve and get a more comfortable sleep.